Good day, everybody. Welcome to Rural Insights podcast series. And today we're again pleased, he's been with us before, is David Jahn, who is the president and CEO of War Memorial Hospital over in the Eastern UP in Sault Ste. Marie and serves a good chunk of the Upper Peninsula. And we're going to get some updates from him on a number of what's going on. Welcome, David. Good to see you again.
Thanks, David. Good to see you as well.
So tell us about, you have a new affiliation. What's that all about?
Yes, we just signed a definitive agreement with their new name now is called My Michigan Health. It was Mid Michigan, but since our signing of the agreement, they're no longer Mid. They're all over Michigan, so they just changed their name to My Michigan Health. We've been at this process of looking for a potential partner for probably 10 plus years, but we've been able to survive as an independent hospital for a long time. And back in 2018, 2019, we had some struggles financially. And at that point, we thought maybe this is a time to look for a partner. And we sent out RFPs to 6 different hospital systems, and over the course of time whittled it down to a couple, and then chose my Michigan, and that should be a beneficial thing for the Eastern UP for sure. I know My Michigan is now also a partner with Mackinac Straits Hospital in St. Ignace, and I'm pretty sure they're looking to partner with Helen Newberry Joy Hospital in Newberry with their electronic health record. It'd be nice to have all 3 hospitals in the Eastern UP working together to provide as much care as possible in the Eastern UP.
So My Michigan is MY Michigan or MI Michigan?
MY Michigan, all one word.
My Michigan.
Yep.
Okay. And so tell us, so patients that come to you, the advantage to being part of this, you're part of the University of Michigan health system, right?
Correct.
What to give you?
Well, from a patient perspective, patients won't see a huge difference. We hear right now, well, I don't want to go to Midland when I could go someplace closer. Well, as you know, with the EMTALA laws and other things, we have to send any emergency to the closest, most appropriate facility. And, we're not going to change geography. So McLaren, Northern Michigan, and Petoskey is still going to be the closest, most appropriate. So patients will go there a lot of the time. But in our ER, there are times where McLaren, Northern Michigan can't provide the service that's needed and needs a higher level of care. And, a lot of times we'll try to transfer to University of Michigan Health System and they won't have any beds. But because My Michigan is part of University of Michigan Health System, we'll have the bat phone or whatever, the hotline, and we're told we'll have much easier access to get an open bed at the University of Michigan Health System for those patients that can't be treated locally or in Petoskey, Traverse City, or Marquette.
Would there be University of Michigan Health System physicians coming up occasionally to War Memorial?
There may be. More than anything, we may have access via telemedicine, to some of their specialists. And there's a conditions of use agreement where we're allowed to use the Block M on our signage and things, but we have to meet the same quality standards as University of Michigan Health System. So we think we provide high quality care here, and a lot of times when you're in a small community, the grass seems to always be greener on the other side, and people don't think that you do a good job in the small local community. And so just to have that behind us, to say we're meeting the same standards as Michigan medicine, that's going to be beneficial to us.
So let me switch over to some of the rural issues. We're hearing all across the country talks about staff shortages in healthcare professions, and clinics, hospitals all across the board. And I know you've served on national boards dealing with rural healthcare and are a national expert. Can you talk a little bit about it globally, but also what's happening in places like the Upper Peninsula with the labor shortage or the shortage of trained professionals?
Sure, and it's not just the shortage of trained professionals, it's throughout probably most organizations just trying to find enough people to work. But we're struggling. A lot of hospitals are struggling. Right now we're at capacity, and just like other Michigan hospitals, and we've had to delay some surgeries because there's just not enough staff to take care of them. We have patients we call ED overs, where patients have to stay in the ED until we can get them up to a bed in our medical surgical floor, or until they can be transferred somewhere else. But other hospitals can't accept them either, because they're full. And you can only, we have 49 beds, but if you only have staff to have 30 open or 35 or 36 open, you can't accept any more. And then when you have ED overs, that stresses the emergency department nurses, because they're not only having to take care of patients who should be up on the medical floor, they're taking care of emergencies. And I just read an article today from actually University of Michigan Health System where there's people in the community that are not COVID related that are dying because they can't get in to see can't get into the ER, can't get in to see people, can't get transferred to the appropriate facilities because we're all so stressed because of staffing. And it's nurses, it's certified nurse aides, it's phlebotomists, it's housekeepers, it's food nutrition workers. I mean, just this week, actually yesterday, we had to close down our cafeteria for staff breakfast and dinner because we can't find cooks. And we have to focus our efforts on serving meals to the patients and residents here. And if we can't find cooks to cook the food, then it's not good for our employees, because it's nice to come to work and be able to grab a bite to eat before you start your 12-hour shift. And when you have to bring it in yourself or not have breakfast, it's not good. And that's throughout the country, and I really don't know when it's going to end. It's not all COVID related, but obviously, there's nobody in the workforce these days, and how do we get more people into the workforce?
So what are and you're right, that's facing every sector of the economy right now, and I think for people it's even scarier when they hear they can't get into a hospital, or they can't get this or they can't get that related to their healthcare. What's your COVID situation like over in the Eastern UP? I know it's the numbers for the statewide, and I've heard some of the other regions of the UP. What's the situation in the Eastern UP?
Yeah, what most people don't realize is that we're worse now from a state perspective than we were at the peak of the pandemic almost 2 years ago. And nobody's really talking about it. And, but inside healthcare institutions, we're talking about it every day. And, we're not at our max. Our max that we had at one time was last year about this time, when we had 23 COVID patients. But at that time, we had more staff too to take care of them. And a lot of those COVID patients were from the Department of Corrections, because we have two very large prisons here that had an outbreak at that time. And the Department of Corrections has done a great job of managing that internally, so they're not coming to our facility. But right now, currently, we have 2 in ICU and 8 in the med surg floor, so 10. It's manageable, but again, when you have less staff, if we didn't have those 10 patients there, the COVID patients, we could take care of more patients that are sitting in the ER and those type of things. And so, it is a challenge. And, as statistics bear out, somewhere between 75 and 80% of the people getting admitted to the hospital are unvaccinated. And, the only way we're going to get out of this is to get people vaccinated. Now we did have, I don't want it to be all doom and gloom about that, but we did have we did have a success story, which was really good. I mean, I feel for the patient, but there was a 39-year-old that was in here and had been in here for 35 days and for 2 weeks was on the ventilator. And then you can't keep somebody past 2 weeks on a ventilator. And you had to do a tracheostomy. And I really thought, boy, the prognosis for this person is not good. Yet somehow the lungs healed and the patient was discharged on home oxygen yesterday. So, not everybody perishes that gets that sick, but that's the type of thing you can get into where, how many of us would want to sit in a hospital bed for 40 days and be at the edge of life and death? I would hope most people wouldn't want to endure that, and that they would, really think again about whether they should be vaccinated or not.
What's your vaccination rate over in the Eastern End?
Well, I know for our employees, it's about 80%. I think in the Eastern End, it's somewhere in the mid 50s to maybe 60%. I mean, when it was only 65 and over, I think we're 70+%. But then, they added on the younger people and now the kids, and it takes time to get everybody vaccinated. So those percentages come down. But I know that the vaccine mandate, which is on hold right now, was worrisome because, we can't afford to lose 2 employees, let alone, 30 or 40 employees. And we've gone through that, and we've had, I think 100 and some people file religious exceptions and maybe 15 or 20 file medical exceptions. But when you look at it right now, everybody in our organization, but maybe 10 people have either picked one or the other. So that if that vaccine mandate comes back, if the courts say it is constitutional or legal, we'll still have to deal with those 10 people to make a choice. But it's better than we thought.
So when you're thinking, sort of wrapping up, what are the next 2 years? I know that seems like 100 years right now in the middle of all this and the pandemic, everything. What are the things you're thinking about that you got to keep your priority and focus on for War Memorial as the president and CEO? What for the next year or 2 years?
Well, the shoe hasn't fallen yet, but the whole financial piece of this pandemic has to fall at some time, because when you're short-staffed and when you want to retain your employees, you're usually giving them additional income, giving them additional sign-on bonuses and things like that. And if you can't, then you're paying pretty exorbitant rates for travelers. And we used to pay somewhere in the $70 to $80 an hour for a traveling nurse, and now it's $200 an hour. And I know the state and federal government are looking into those traveling nurse companies, saying, are they taking advantage of the times? And but we're not getting any more additional revenue from Medicare or Medicaid or Blue Cross. And when you're paying that much more to your workforce, somewhere there's got to be a financial shoe that has to drop, and it's going to hit mostly in rural areas first, because we're much smaller and don't have the depth and breadth of an organization that some larger ones do. But also, just getting enough people in the healthcare workforce. I mean, I think what this pandemic has shown is that healthcare is one of the toughest jobs around, and it's not only physically tough, it's mentally tough. And when in the past, you saw death, and it was usually at the end of life when somebody was elderly or somebody that had a medical emergency or got in an accident or whatever. And now, you're seeing death from people who walked in and have their mind yet, and they just can't breathe. It's really tough on a nurse when that patient said, I can't live like this, and you got to take this high flow oxygen off me, and within 15 minutes they're gone. Yet they had all their faculties and had no other comorbid conditions or that sort of thing. So how do we get people into healthcare, and how do we get the education system to make sure we're training enough of these healthcare professionals? Because it's very difficult. I know it's hard for the universities, to have the curriculum and follow all the criteria that they need to follow, and for them to hire, nursing instructors who, in order to be accredited, you have to have certain level of nursing instructors. But at the same time, we need to produce more nurses and more nurse aides and more LPNs and those type of things to be able to survive in the healthcare of the future.
David, just before we wrap up, can you tell our listeners what a traveling nurse is?
Well, a traveling nurse is somebody who basically is for hire through a travel company. So we've actually lost probably 10 of our nurses to travel companies lately. What happens, if you're young, or if you're older and have already, raised your kids and, have the flexibility, a company will hire you for a 3-month stint or a 6-month stint somewhere, and you'll probably make twice as much money as you would working for your local hospital. And then there's a fee that the traveling nurse companies put on top of that. So, they might be billing us $200 an hour, but the nurse is probably getting maybe 70 or 80 bucks an hour, and the company's making the other 120 an hour. And just for arranging for them to be there, and for young nurses, once they get some experience, they're thinking, hey, I want to go out and see the world. And, instead of staying in Sault Ste. Marie in January and February and March, I could go and get a travel job in Arizona or Florida or California. And since I can come back in the summer and enjoy the warm weather, I can create my own little perfect scenario where I never have to see snow again. But it really puts, small rural hospitals, especially hospitals in the northern climate, at a disadvantage.
Well, David, thank you for spending this time with us. That's been really informative. And the challenges are immense. And it's good to know there are leaders like you out there helping us through this in the rural areas and all the added challenges that we have. So David Jahn, President and CEO of War Memorial Hospital in Sault Ste. Marie, thank you, my friend, very much.
Thank you, David.